To get started with MRI-only treatment planning for prostate cancer, there's a few things you need to have in place. Once you have these in place, your workflow is not very different from your conventional CT-based workflow. First of all, you need to be able to MRI scan your patient in treatment position. This typically means having a flat tabletop, MRI-compatible knee couches, and footrests. Further, the use of coil bridges avoid any receiving coil to deform or compress your patient body contour. It is not a requirement, but if you have a laser positioning system installed with your MRI, the procedure is even more similar to your CT-based workflow. Put the patient on the table and place your tattoo spots at your reference points. Always make sure to use an MRI-compatible ink not to cause image artifacts. The external markers are attached to the reference points and visible in the MRI images. Whatever method you choose for generating the synthetic CT, one or more MRI acquisition sequences must be acquired. At Skåne University Hospital in Sweden, we've been using Spectronic Medical MRI Planner to do the conversion from MRI data to synthetic CT data. For generation of synthetic CT, a T2-weighted image with a large field of view to cover the body contour is required. We also acquire a set of high-resolution T2-weighted images zoomed at the prostate with small field of view for target delineation. When using Spectronic Medical MRI Planner software, your MRI images can be sent to a dedicated receiver and the generation of the synthetic CT will start automatically. The synthetic CT can then be forwarded to your treatment planning system. After importing the synthetic CT, you proceed to target and organ delineation. Since the synthetic CT and the large field of view T2-weighted image are in the same frame of reference, there is no image mismatch and no image registration needed. This is a huge advantage. Here we show the small field of view images used for target delineation on top of the synthetic CT. Once all your delineations are in place, creation of the treatment plan and optimization are performed using the same clinical criteria as you would use in a conventional CT-based workflow. The procedure works equally well regardless if you're creating an IMRT or VMAT treatment plan. Once your treatment planning is complete, clinical QA routine follow as usual.